Thank you everyone for attending the webinar today. My name is Holly Marita and I'm with David Insurance out of Wisconsin. Just a few housekeeping items. If you have questions, please enter them in the chat. We will be able to answer them all at the end. And if we don't get to all of the questions, we'll send out an FAQ so we can get all of your questions answered. So today we're excited to bring you a 4-tiered webinar series, understanding the 4 components of your self-funded plan. Today's webinar is focused on reducing claims within your self-funded plan, and our guest speaker is Jeannie Moore. She has more than 25 years of experience building and managing customized cost containment strategies for employers of all sizes across the nation. Jeannie is the best-selling author of Nurses Take Back Healthcare One Employer at a Time. So I'm going to turn it over to Jeannie to take the show. Hi, Jeannie.
Hi, Holly. Thank you for inviting me to present today. It's an absolute pleasure to talk about one of my favorite topics, and that's how to reduce claims in a self-funded health plan. Believe it or not, it's one of my favorites. So in the health plan design for a self-funded health plan, there are 3 fundamental components. The first one is the claims adjudication process. The second is a financial risk insurance policy, better known as stop-loss reinsurance. And then the third are the variety of cost containment strategies that are available. Self-funding is appropriate for employers who have 50 employees or more, especially when they have those right cost containment strategies in place. In fact, when the employer has the right combination of cost containment strategies in place, they can often get their stop-loss coverage at a much lower rate. So there is literally a plethora of cost containment strategies in the market today. You'll notice that I put PPO networks and reference-based reimbursement strategies in there. They are actually a part of that cost containment strategies, not a part of the actual claims adjudication process. Pharmacy benefit management, utilization case care, disease management, wellness program, etc. Unfortunately, there are just a few that work extremely well in cost containment. Unfortunately, the majority of them fail to truly curb the cost for healthcare. The trouble for most employers and a lot of the brokers that I work with is understanding which one or what combination of a few are the best for that specific total membership or the total population of that employer. And that's where Connections Healthcare Cost Containment starts our process in assessing the unique requirements of the employer and setting the stage for a customized set of solutions. So I'm going to fill you in on a little secret. The secret is about 30 years worth of performing claims data analytics. It's always the same breakdown regardless of the size of the organization. So whether I'm working with an employer who has 50 employees or 50,000 employees, these percentages that I'm about to discuss stay relatively the same. So in any given population, 90% of that group, they're running around, living life, working their job, taking kids back and forth to school. They're just kind of doing their thing. These folks are occasionally visiting the healthcare delivery system for things like prevention or an acute care need, such as a broken arm, strep throat. Some of them don't even enter the healthcare system at all, which can be another topic for another day. The 10% in the red of that population is entering the healthcare system on a relatively routine basis. This is for follow-up care, testing, ongoing monitoring, and they are most likely taking multiple medications to manage multiple specific conditions. Less than 3%, actually that number is closer to 2 to 2.65% of the population can spend nearly 45% of the total claims. So let's think about the last time you sat down with your carrier or your broker and reviewed the actual health plan performance. Your broker and your insurance carrier showed you all of the data if they had access to it, and they may have said something to the effect of there's nothing you can do about those high cost claimants. It's just the luck of the draw. Or they might say it's been a bad year for high cost claimants, and that's the reason why your premiums are escalating out of control. Then they add, we've carved out the high cost claimants from this performance report because it skews the data. So let me repeat that again because it's really important for you to understand. Today, your carrier and your broker removes the one segment of the population that is a cause of nearly half of the total spend, and they simply dismiss it. In fact, there's a number of ways your current carrier or broker discuss the performance of your health plan that are based on false assumptions. And unfortunately, I don't have enough time to dive deep into this subject, but let's just suffice it to say, beware of false assumptions based on past claims experience or perceived consumer behavior. Let's look at a typical health plan with a variety of cost containment strategies in place. And I just kind of randomly chose different cost containment strategies. First, let's walk through the process of the care, claims, and cost. First, the patient enters the healthcare delivery system to obtain the care. And then the provider will submit a claim, generating a cost. And you will notice that over on the far left-hand side of the screen with the cost containment strategies in red, medical management, specifically utilization and case management, are the only cost containment strategies that impact the cost prior to the care being delivered. So here's a little history lesson. Starting back in 2008, with the passing of the Affordable Care Act, there was a response to of that medical loss ratio component of the law by the major health insurance carriers. Basically, what the medical loss ratio said was for every premium dollar that you collect, insurance company, 85% has to go towards the payment of claims, leaving only 15% of the profit margin to the carrier. So in order to improve their profit margins, this is their reaction. Essentially, what the employer is left with is a system where the employee has a credit card in front of a smorgasbord of health services that they can choose from without knowing whether or not they really need the service or how much it's going to cost before they purchase it. And help me understand, what other expense line item in your company's budget do you allow the employee free rein spending? This is the reality of the BUCA, Blue Cross Blue Shield, United, Cigna, Aetna, Humana. This is the reality of what employers are purchasing today. So managing the health plan is a messy process. There are a lot of moving parts, and it's not for the faint of heart. There's so much movement within that population clinically that you really have to understand how a population moves and shifts over time. It is critical for employers to have the right clinical and financial experts who understand every single process. If you're currently fully insured or even a mid-sized self-funded plan, I would say any self-funded plan under 1,000 employee lives, and you're with a major carrier, you aren't getting the data you need to appropriately manage the plan. Not only do you require access to the data, you need the right people analyzing the data, folks that can take that data and make it actionable. So 99% of what's in the market today regarding your data is not made actionable by the right people. So you're spending hours wasted just simply looking at all of the data and failed strategies. This is another topic that I could talk for 8 hours on, but we don't have the time here. So let me just give you one small tip. Focusing in on the chronic condition management or lifestyle management, wellness, thinking about the $50,000 in the form of a wellness credit is not worth staying where you are. It's simply focusing on that 90% of the population and not that top 10 and 20% where all the money is actually residing. So looking at past claims does nothing to tell you where you're going to be spending money tomorrow. The folks that help you manage your health plan must have a very strong understanding of how the healthcare delivery system actually works. Not all hospitals and doctors or clinics provide the same high quality of care. In fact, the quality of care that you receive in the United States is directly correlated with your zip code. There have been numerous studies released over the last several years, I'm going to say all the way back to the early 2000s, examining the quality of care in the United States. And what you need to take away from this slide is that we as a nation are overdiagnosed, overtreated, and overprescribed. And sadly to say, in 2020, our average life expectancy is falling. We're dying at younger ages. Quality of care is a significant issue, considering your current healthcare delivery model, a model that has been designed to be one gigantic revenue generating engine. The healthcare delivery system is an inefficient, siloed, locked, and abhorrent system. In a nutshell, in order to contain the costs, you must reduce the frequency and severity of claims. Cost containment must be ensure that your employees and their families are getting the highest quality of care at the lowest possible price. The employer's health plan has to be proactive, predictive, and most importantly, it has to be transparent. The process starts with a sophisticated predictive analytics engine that's burning and churning through the claims data information. If you're lucky, it is being added to by registered nurses who are providing that soft data that's not found in claims. The intent purpose of this new paradigm is to pair each patient that is entering the healthcare system with a concierge registered nurse who has both the health insurance and healthcare delivery expertise available to her. So we want to make sure that we find the right patient, that they obtain the right diagnosis and treatment at the right place, outpatient versus inpatient, at the right time in that course of the disease process, and that they're obtaining it at the right price, that you're not paying $3,000 for something that should cost $100. So while we're at it, what we do is we pair that with a transparent TPA. The TPA is third-party administrator, that's your claims adjudication portion of it, and a transparent PBM. We also match it up with a really great stop-loss partner. Your stop-loss partner is probably one of the most important components of this package because they're your true quarterback. They're going to protect you when you need protection the most. And having a stop-loss partner that truly understands what's going on in your population and all the cost containment strategies that you put in place is critical. So what we're doing by formulating these various cost containment strategies is ensuring that your membership is getting the highest quality of care, but we're significantly lowering the costs so that you can put money back into your employee's paycheck. And we do that by reducing their deductibles, their out-of-pockets, their co-insurance, and while we're at it, we're improving the employer's bottom line. So much so, in fact, that we have clients that are offering free healthcare benefits to their employees. The notion of being an employer of choice, which is pretty important for most employers, will be contingent upon offering robust, free healthcare benefits. Tomorrow's health plan will protect the American employee's physical, emotional, spiritual, and financial health. Healthcare is a captive expense, and we know that a capital expense produces a return on investment. Yet most brokers and carriers will tell you your healthcare is an operating expense, something that you can't control. If I'm right, and we all know that I am, who is currently accountable for this capital expense return on investment? Today, it's your insurance broker who is aligned with your insurance carrier who together educate your human resources department. What you need are independent subject matter experts who are aligned with your organization and your employees' best interest. We're partners who can best manage the supply chain of the healthcare delivery and the health plan. Partners who have the product knowledge and expertise, product development expertise to build that customized solution, all while providing evidence-based medicine and financial benchmarks that set the stage for continuous process improvement. The ultimate success of a self-funded plan is contingent upon two things, especially from an implementation perspective. Those two things are a customized communication package and employee engagement. The working components of a health plan should start with the immediate needs of the people being covered and then transition over time. So we work very diligently and work very closely with the C-suite to make sure that you have the right set of communication skills, that your human resources department has the right communication set, and that it's very specific and it's managed effectively. This all rolls into employee communication, which has to be really easy to understand, and it has to be consistent from all parties. So essentially, the success of an implementation and ongoing program is about effectively setting the stage. So Connections Healthcare Cost Containment, what we do here is we build employee-centric benefit plans that move and shift with your employee population. We have proven strategies, guaranteed, and measurable results that are based on medical science rather than a carrier or broker's book of business benchmarks. If you're looking at carrier or broker book of business benchmarks, you're only comparing one broken system with another broken system. And you're asking the question, how broken are we? For us, for the registered nurses at Connections Healthcare Cost Containment, it's all about helping employers protect and reward their most valuable asset, the American employee. So the very first question we ask each employer when we begin working with them is, how much do you want to pay? The second is, how fast do you want to get there? In 2020, the national average per employee, and I get this information from Milliman Medical Index, is printed every year. The average per employee per year cost, or PEPY, is just over $17,000. This number includes the employee's deductibles and out-of-pocket costs. So it's what the employer pays plus what the employees pay for the total allowed amount. Depending on your zip code, that PEPY can be higher or lower than that $17,000. So if you're in the Midwest, you're probably running somewhere around $10,000 PEPY, give or take $1,500 to $2,000. If you're on either coast, west or east, the sticker price of $17,000 PEPY may look pretty good. The highest I've seen across the nation is $28,000 per employee per year. So the amount you pay is directly related to the combination of cost containment strategies that you deploy. The registered nurse consultants at Connections Healthcare Cost Containments, we help you make those decisions. We customize the solution to fit your employee base and your C-suite strategy, and we measure your long-term success. So with that, it's all about customization and how can we help you. So Holly, do we have any questions?
Yes, definitely. We have a couple. So first would be, in order to help my employees, do you interact directly with them or do I become the middleman?
Right. So the answer to most questions that I have is it depends, because we do so much customization. It really depends on the culture of the organization. What is the relationship that you feel that your C-suite has with your current employee base? Are you a paternalistic organization? Are your employees kind of kept off at bay? So it really depends. we absolutely will work with the employer to design something from a communication strategy that already uses the different tools that you have available, and then we'll bring in ones that may not exist.
Perfect. Another question we have is, how hard is it to implement this concept, and do I have to do it at open enrollment, or can I do it mid-year?
Right. So I love this question because the answer is we don't care about any of the timeframes that are superimposed with the current mindset that this has to be done on an annual basis during the renewal time with the enrollment. We as registered nurses can walk into any situation at any time and have an impact on the cost. It's kind of a no-brainer for us. Once we kind of come in and start to take a look at what's going on and design a plan and process based on what those contractual statements say, we can aim towards those dates. So it really makes no difference to us.
Awesome. And then just for sake of time here, because we want to be mindful of everybody's commitment here, we'll just take one more. You mentioned lowering the employee out-of-pocket costs. Can you just kind of explain a little bit more how you're able to do that?
Right. So basically what we're doing is we're coming in and we're removing any of the fraud, waste, and abuse that's within the system. We're making sure that people get the highest quality of care at the lowest cost. So instead of getting a sticker shock bill for a service that you actually need, we're going to find that service at the very lowest cost. So when you start pulling down that cost of the claims over time, you have more pool in which you can spread that savings out over to your employees. So to give you an example of a patient who would be calling in to one of our registered nurses about a service, we're going to be able to go into our system and look at, find the highest quality of care provider for that service that has the lowest cost. So we're always constantly giving the member the option, right? The option of, we can send you over here to this provider and waive your copay and deductible, or you can continue on your path, but the service would be attributed to your deductible and out of pocket. Which would you prefer? And we do have the ability to look at that quality component. So we're making sure we're directing people to the best surgeon, the best podiatrist, the best, it's whatever their need is.
Awesome. All right. Well, based off of that, we want to thank you for all your insight, your expertise. I'm sure we'll have some questions in the future. And just wanted to let everybody know that our next webinar is September 10th. So a week from today, we'll start at 8 o'clock. Steve Butts from Certis Management Group will be with us. He's going to be covering managing self-funded risk, the role of the stop-loss carrier. So mark your calendars. And again, we appreciate everybody taking time this morning, and have a great day.
All right.
Thanks.
Thanks, Holly.